My name is Melanie Tira, and I'm the Community Health Services Division Manager with the Bristol Bay Area Health Corporation in Southwest Alaska, serving the community of Dillingham and 34 Alaska Native villages. Within our behavioral health department, we have a behavioral health center, and that's where our clinicians operate out of, and our suicide prevention outreach personnel. Also under the same umbrella, we have a residential and a day treatment facility for substance use disorder. It's a natural interaction between the two, but even under the same umbrella, we had challenges. So we've worked a lot in the past year to strengthen the relationship between the two units. There are some pretty structured things we've done to help that relationship. The one we're working on right now is for our substance abuse counselors to provide integrated assessments. In the past, it was a substance abuse-focused assessment that was done by our staff here at our residential center and also within the villages with our behavioral health aides. So it was within the last month evaluating for mental health conditions was added as well. We found that a very high percentage of our patients have co-occurring disorders, more than half. It was a good fit for us to do that. In our suicide prevention side of things, we've really worked on the ground with a lot of communities to identify key people who will help champion our cause when we're not there. We don't live in those communities, so to come in and to expect you're going to bring in a canned program, drop it in and leave, it's just not effective. So we spent a lot of time with our suicide prevention team really studying the communities within the scope of the project. There are 14 communities, and none of them are connected to each other, short of 2. Every other community we fly into, so it required a lot of coordination, a lot of time to study the needs of each individual community. They're each at very different levels of support and enthusiasm, and even how suicide has impacted them. All have been impacted by substance abuse, but suicide is something that if you've had an event within the last 5 years, it feels different than if it were further back. But really just figuring out where each community is at, I would say it's the most important thing we've done and also has taken the most time.